let's talk about the holiday season. Traditionally, this time of year, a lot of people take a break, and that might be the perfect time that they think about getting a procedure. So to talk about a little bit more about these procedures right now, joining me is board-certified dermatologist, Dr. Billy Groff. And you know, when I think about procedure, I think the first thing that comes to my mind is downtime. But
that's right.
It's changed.
Well, that's true. Downtimes have gotten shorter with pretty much all procedures, but you know, because we're celebrating the holidays, whether you celebrate Christmas, Hanukkah, Kwanzaa, Festivus, whatever, we all have some time off work, right? So it's the perfect time to get a procedure done. So depending on the procedure, there's certain days that you might need off of work. And we can talk about some of those procedures, and I'll talk about how much time you might need so you can be prepared if you want to come in.
Yeah, and you've got a couple of procedures that we're talking about right now. And just tell us which ones you're talking about.
Yeah, so for example, here's a patient of mine that I did one laser resurfacing treatment on. Both these women have had laser resurfacing. Typically, you need about a week to 10 days of downtime until you're peeled and healed and look great. You can see how it can take like 10, 15 years off a patient's appearance.
Wow.
By taking the lines and the wrinkles away from the mouth, tightens and smooths the skin, and really you get a nice tightening effect on the upper eyelid as well.
And the neck and, it looks like the neck and chin area too as
sure,
well.
For sure. Now here's a patient who's had liposculpture. This patient actually was able to drive herself home from the procedure that day because it's done under local anesthesia. You don't have to go under general anesthesia, particularly with neck lipo. It's so simple. Almost everyone drives themselves home. You can go back to work in a few days. Perfect for over the holidays.
And this is something that I had struggled with myself for a couple of years, is those brown spots that you get on your face. I had one here, and I actually had some laser work, and it's gone. It's so great.
Oh, it's amazing, and particularly with patients with more olive skin, one of the common problems they have is getting brown spots. It's not so much wrinkling like in lighter skin like mine, for example. For darker skin patients, it's brown spots. So with one treatment, we can usually remove about, I'd say 70 to 90% of the spots, but there will be a peeling effect. It's a light peel, granted, but you still might want to have 4 days off of work or so.
Yeah, and it usually just flakes right off.
Yeah, they turn a little bit darker and then they just gently come off the skin. It's really neat, actually.
Yeah, it is a great procedure. And another thing that people struggle too with is acne.
Well, this is for the younger population, but certainly acne does affect even patients into their 40s. But we have a procedure called Photodynamic Therapy. We put this medication on your skin, and then we expose your skin to certain types of light and lasers. Those lasers and lights trigger the medication to actually shrink the oil glands and kill the bacteria that causes acne. So it can be really transformative for patients who suffer from bad acne. These are patients of mine that have had just one treatment. You can see how good they look after treatment.
And something, and this is great results right here, and something a lot of other people struggle with, not only just acne, but also rosacea too. I know a lot of women in the older population, they think makeup will help it, but it actually doesn't always cover all
Right, so rosacea, like this gentleman that they're showing, and this gentleman has RHINOPHYMA, which is an enlarged nose from his rosacea. So these are all, again, one treatment that I did on these patients. You can see how with a laser I can sculpt away the irregularities of the nose, but I can also get rid of the broken capillaries. Typically, you need about anywhere from a few days to a week of downtime to recover from a procedure like this.
And this is, like we said, this is the best time to do it, because if you have that time, why not get
and for
it
the
done?
kids who suffer from acne, they usually have like 2 weeks off of school. So, with the PDT treatment, you need about 4 or 5 days. This is a perfect time of year to do it.
And I mean, what about price-wise? Are these expensive procedures or not really? Or?
Well, the procedures we discussed today, they can range anywhere from a few hundred to probably 5,000 or 6,000, depending on what we're doing.
And certainly they usually make people feel better after they're
Oh,
done.
sure. What a great way to start the new year, right?
Exactly. All right, thank you so much for joining us today,
Thank you for having me.
Dr.
I appreciate it.
All right, so for more on these procedures and Dr. Groff, you can go to our website at fox5sandiego.com and just click on that Scene On tab.